Raw onions, despite their health benefits, can have negative effects on the body in certain conditions. It's important to know that eating them can aggravate symptoms or cause discomfort. Let's take a look at which 13 health conditions you should avoid eating raw onions based on medical recommendations. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like and let's get started. Number 1. Drug interactions. The interaction of raw onions with certain medications can make a significant difference in a person's health, especially if you take medications on a regular basis. Here are the main aspects to consider. 1. Effect on liver enzymes. Raw onions contain bioactive compounds such as allicins, which can affect the activity of enzymes in the liver. These enzymes are involved in the metabolism of many drugs. For example, onions can stimulate cytochrome P450 activity, which can lead to accelerated metabolism of some drugs and decrease their effectiveness. 2. Decreased drug concentration in the blood. The interaction of onions with drugs can lead to decreased drug concentrations in the blood, which may reduce their therapeutic efficacy. This is especially important in the treatment of chronic diseases, where stable drug concentrations in the blood are critical to achieve the desired therapeutic effect. 3. Increased side effects. Some active ingredients in onions may increase the side effects of some medications, especially those that affect the CNS or cardiovascular system. For example, onions may increase the hypotensive effects of antihypertensive drugs or increase the sedative effects of some psychotropic drugs. 4. Individual reactions. The response to onion drug interactions can vary greatly depending on the individual physiologic characteristics of the person. In some individuals, the effect of onions on the efficacy or safety of medications may be minimal, while in others, the effect may be significant. 5. Physician recommendations. Medication should always be taken under the supervision of a physician who takes into account all possible factors, including diet and potential interactions with foods, including onions. The physician may recommend dietary restriction or modification to minimize the risk of unwanted interactions. Thus, it is important to consider raw onion drug interactions as part of a comprehensive treatment approach, especially with long-term and systematic use of medications. Number 2. Blood pressure problems. Blood pressure problems, especially hypertension, require special attention to diet and the foods consumed. Onions, in particular, can have a definite effect on blood pressure in some people. Here are some things to consider. 1. Diuretic properties. Onions have a mild diuretic effect, which means they help increase urine output. In people with hypertension, this can sometimes cause them to lose some fluid and, as a result, temporarily lower their blood pressure. However, this effect is usually short-lived and does not stabilize blood pressure for a long time. 2. Reaction to onion ingredients. Some onion ingredients can affect the circulatory system. For example, sulfur-containing compounds such as allicins can temporarily dilate blood vessels, which can cause a temporary drop in blood pressure. In people with hypertension, this may be beneficial, but it is important to consider each patient's individual response. 3. Individual sensitivity. Reactions to onions can vary widely. In some people with hypertension, eating onions can cause allergic or nonspecific reactions that can affect overall health and wellness. 4. Blood pressure control. When you have hypertension, it is important to strictly control your blood pressure and measure it regularly. If onion consumption causes significant fluctuations in blood pressure or causes discomfort, it is advisable to discuss this with your doctor to develop a personalized diet plan. In summary, onion consumption can have some effect on blood pressure in people with hypertension, and it is important to take into account individual differences and doctors' recommendations to maintain optimal cardiovascular health. Number 3. Cardiovascular disease. Cardiovascular disease can be complicated by the consumption of raw onions due to several main reasons. First, Onions contain enzymes and compounds that can stimulate gas production in the stomach and intestines. This is especially important for people with cardiovascular disease, as excessive gas formation can cause discomfort, increase abdominal pressure, and affect overall health. Second, the pungency of onions and their essential oil content can contribute to heartburn in some people. Heartburn occurs due to irritation of the esophageal mucosa and can be exacerbated in the presence of cardiovascular disease. This discomfort can be particularly uncomfortable for patients who already experience other symptoms or require a special diet because of their condition. Thus, eating raw onions can worsen the overall condition of people with cardiovascular disease, causing not only physical discomfort, but also increasing the extent of the disease. This emphasizes the importance of individualized nutrition and consultation with a physician to establish the best diet for heart and vascular health. Number 4. Kidney disease. Kidney problems can be caused by a variety of factors, including diet and the consumption of certain foods. Raw onions, in particular, can have a negative impact on kidney function, especially in people with pre-existing problems in this area. Here are the aspects that may be important. 1. High purine content. Onions contain high levels of purines, which can lead to the formation of urinary stones in people who suffer from gout or have elevated levels of uric acid in their bodies. This is especially critical for those who already have problems with kidney function, as such conditions can worsen. 2. Increased kidney strain. Consuming large amounts of raw onions can increase urine excretion and kidney strain due to its diuretic properties. This can put additional stress on the weakened kidneys and worsen the overall condition of the patient. 3. Individual sensitivity. Reactions to onions can vary greatly from person to person. Some may be more sensitive to its effects on the kidneys due to individual differences and their health conditions. 4. Doctor's recommendations. For patients with pre-existing kidney function problems or increased uric acid levels, it is important to follow your doctor's recommendations regarding diet and the inclusion or exclusion of certain foods, including onions. This helps minimize the risk of complications and maintain kidney health. Thus, eating large amounts of raw onions may not be compatible with certain kidney diseases. So it is important to discuss any dietary changes with your doctor, especially if you already have diagnosed kidney function problems. Number 5. Liver diseases. Onions contain various bioactive substances, including flavonoids and sulfides, which can have a variety of effects on the body, including the liver. Flavonoids are antioxidants and have potential anti-inflammatory properties that may be beneficial to health in some cases. However, for people with liver disease or a sensitive liver, these substances may pose a risk. Flavonoids. These plant compounds may enhance antioxidant functions, which is generally beneficial for protecting body cells from damage. However, in liver disease, such as cirrhosis or hepatitis, liver function can be impaired, and metabolizing flavonoids can add additional stress to an already weakened organ. Sulfides. These compounds can also affect liver function. The sulfides in onions, such as allicin, can be antibacterial and antifungal, which is good for general health, but consuming them can be uncomfortable for people with liver disease because of their metabolism in the liver. For people with liver disease or other liver problems, it is important to consider the effects of bioactive substances such as flavonoids and sulfides found in onions. These substances can increase the burden on the liver and cause discomfort, especially if onion consumption occurs in large quantities or on a regular basis. Therefore, in such cases, it is advisable to consult a doctor and follow his recommendations on diet and food intake to minimize the negative effects on the liver. Number 6. Pancreas. The pancreas plays a key role in digestion, producing the enzymes and insulin needed for the body to function properly. Onions, especially in their raw form, contain spiciness and essential oils that can have negative effects on the pancreas, especially in people with pre-existing diseases of this organ. Let's take a closer look at why this occurs. 1. The spicy nature of onions. The spicy nature of onions is due to their content of sulfur-containing compounds such as allicin, which can irritate the mucous membrane of the pancreas. This irritation can stimulate the production of additional pancreatic enzymes or increase existing inflammation. 2. Essential oils. Onions contain essential oils that may also have an irritating effect on the pancreas. These substances may contribute to increased inflammation or make people with diseases of this organ, such as pancreatitis, feel sick. 3. Worsening of symptoms. For people suffering from chronic pancreatitis or other pancreatic diseases, eating raw onions can lead to worsening of symptoms such as abdominal pain, dyspepsia, digestive disorders, nausea, or even worsening of the disease. 4. Individual sensitivity. Reactions to onions can be individualized and depend on the degree of inflammation of the pancreas in a particular person. In some people, even small amounts of raw onions can cause significant discomfort. Therefore, people with pancreatic disease are advised to limit or avoid eating raw onions. This will help prevent worsening inflammation and minimize digestive discomfort. Instead of raw onions, you may prefer to heat treat them, which can reduce spiciness and lessen irritation to the pancreas. Number 7. Gastrointestinal disorders. Gastrointestinal disorders, such as peptic ulcers and irritable bowel syndrome, IBS, are characterized by changes in stomach and intestinal function that can lead to pain, dyspepsia, impaired digestion, bloating, and other unpleasant symptoms. In this context, eating raw onions can exacerbate existing problems and cause additional discomfort. Here are the main points explaining why raw onions can be difficult to digest in people with these disorders. 1. Spiciness and irritation. Raw onions contain pungent phytochemicals such as allicin and sulfur-containing compounds that can irritate the mucous membranes of the stomach and intestines. This irritation can exacerbate pre-existing inflammation or ulcers in the gastrointestinal tract, leading to increased pain and discomfort. 2. Gas and bloating. Onions contain oligosaccharides, such as inulin, which are not fully broken down in the stomach and can enter the intestines where they serve as food for bacteria. This can cause increased gas and bloating, which is especially undesirable for people with IBS. 3. Effects on the microbiota. Onion phytochemicals can affect the composition and activity of the gut microbiota. In people with IBS or other chronic gastrointestinal diseases, the microbiota is often disturbed, and the introduction of new food components such as raw onions may cause negative reactions. 4. Individual sensitivities. Reactions to raw onions can vary widely depending on individual differences and disease activity. Some people can tolerate raw onions without any problems, while in others, even small amounts can cause an exacerbation of symptoms. 5. Alternatives. For patients with peptic ulcer disease or IBS, it is recommended to avoid raw onions and prefer them heat-treated. Cooking onions can reduce their spiciness and make them more digestible for the digestive system. In summary, eating raw onions can be difficult to digest in people with chronic gastrointestinal disorders because of their spiciness, ability to cause gas and bloating, and potential irritating effects on mucous membranes. Number 8. Peptic ulcer disease. Ulcer disease is characterized by the presence of ulcers, ulcerative defects, on the mucous membrane of the stomach or duodenum. Consumption of onions in this disease can cause an increase in symptoms and worsen the patient's condition. Here are the points that are important to consider. 1. The spiciness of the onion and its components. Onions contain sulfides, including acute sulfoxidase, which is one of the factors that contribute to their sharp and pungent flavor profile. These substances can irritate the already damaged gastric mucosa, causing discomfort and increasing pain in people with peptic ulcers. 2. Effect on acid secretion. Consumption of onions can stimulate increased secretion of gastric juice, which in turn can increase acidity in the stomach. High acidity contributes to irritation and aggravation of ulcerative defects, resulting in increased pain symptoms and discomfort for patients. 3. Individual sensitivity. Reactions to onions can vary greatly from person to person with peptic ulcer disease. Some may experience more severe symptoms when consuming it, especially if they have a hypersensitivity to spicy and irritating foods. 4. Doctors' recommendations. Doctors often recommend that peptic ulcer patients avoid spicy, fried, and savory foods, including onions, to prevent exacerbation and worsening of the condition. Regular inclusion of onions in the diet can lead to increased discomfort and make ulcers more difficult to treat. As a result, onion consumption for peptic ulcers is not recommended due to its ability to irritate the gastric mucosa and exacerbate the symptoms of the condition. Peptic ulcer patients should follow their doctor's recommendations and avoid potentially irritating foods to maintain a steady state of gastrointestinal health. Number 9. Reflux and gird. Gastroesophageal reflux disease, GERD, is a condition in which stomach contents rise back up into the esophagus due to a weakened sphincter between the stomach and esophagus. People with GERD often experience heartburn, which is a burning sensation and discomfort in the chest and throat area. Here's why eating onions can exacerbate GERD symptoms. 1. The spicy nature of onions. Onions contain a variety of spicy-tasting compounds, including sulfides, which give them their characteristic flavor and aroma. These substances can irritate the esophageal mucosa and cause a burning sensation, heartburn, in people with GERD. 2. Stimulation of acid production. Eating spicy and irritating foods such as onions can stimulate the stomach to produce more gastric juice. This increases the acidity of the stomach contents, which in turn can promote reflux, the rising of stomach contents back up into the esophagus. 3. Individual sensitivity. Reactions to onions can be individualized and depend on the patient's sensitivity to spicy and irritating foods. In some people, even small amounts of onions can cause a significant increase in GERD symptoms. 4. Recommendations for patients. Patients with diagnosed GERD are advised to avoid spicy, fried, and savory foods, including onions, to prevent worsening of symptoms. This is important to maintain a stable esophageal condition and reduce the frequency and severity of heartburn. In summary, onion consumption may not be desirable for people with GERD due to its spicy nature and ability to cause heartburn. Patients should consider individualized physician recommendations and appropriate nutritional therapy strategies to manage this condition and prevent potential exacerbations. Number 10. Thyroid problems. Thyroid problems can include hypothyroidism, insufficient thyroid function, or hyperthyroidism, excessive function. Onions contain some substances that can affect the function of this gland, which may be a reason to limit their consumption in people with thyroid problems. Here are the main points to consider. 1. Glucosinolates and gauthyricine. Onions contain glucosinolates, which when broken down form gauthyricine. These substances can affect the thyroid gland and its function. For example, some studies show that gauthyricine may interfere with the synthesis of thyroid hormones or alter their levels in the body. 2. Action on iodine production. Onions may also affect the processes involved in the formation and absorption of iodine, which plays a key role in thyroid function. This effect can be either positive or negative depending on individual characteristics and thyroid status. 3. Individual sensitivity. Reactions to onions can vary greatly among people with thyroid conditions. Some people may experience changes in gland function when onions are consumed, while others may tolerate them without obvious negative effects. 4. Doctor's recommendations. Because of the potential effects on the thyroid gland, it is important to consider the individual patient and doctor's recommendations. People with thyroid disease may be advised to limit onion consumption or control the amount of onions in their diet to avoid unwanted effects. In summary, onion consumption may require restrictions in people with thyroid disease because of its potential effects on the function of this organ, especially if such effects may be adverse or require medical monitoring. Number 11. Dental and oral problems. Dental and oral problems can be exacerbated in people who consume raw onions, especially if they already suffer from certain health conditions or have sensitive teeth and gums. Here are the points to consider. 1. Spiciness and chemicals. Raw onions contain pungent flavoring agents and phytochemicals such as allicins, which can irritate the oral mucosa. This can cause discomfort and increased inflammation in the gums. 2. Risk to tooth enamel. The chemicals in onions can be corrosive to tooth enamel. When raw onions are consumed frequently or in large quantities, it can contribute to the destruction of tooth enamel, which can eventually lead to increased tooth sensitivity and even tooth decay. 3. Gum threat. The pungent substances in onions can also irritate the gums. Constant irritation can lead to inflamed and bleeding gums, especially in people who already have problems with their teeth or gums, such as periodontitis or gingivitis. 4. Impact on overall oral health. Constant exposure of the oral cavity to sharp substances can alter its pH and microbiome, which can also contribute to various oral diseases. 5. Individual sensitivity. The reaction to eating raw onions can vary greatly depending on each person's sensitivity. Some people may experience more discomfort and impact on their teeth and gums than others. In general, if you have pre-existing dental and oral problems, eating raw onions can make the situation worse. It is advisable to be cautious and, if necessary, consult with a dentist to develop an individualized approach to diet and oral care. Number 12. Allergic reactions. Allergic reactions to onions can be a serious health risk for people suffering from this intolerance. Here's a detailed explanation of why eating raw onions can cause these reactions. 1. Allergens in onions. Onions contain specific proteins and chemicals that can be allergens for some people. Reactions are especially common to the protein aline lyase, which breaks down during slicing or chewing, releasing acute sulfidase, which causes an allergic reaction. 2 typical symptoms. Consumption of raw onions can cause itchy skin, rashes, hives, and swelling of the face, lips, or tongue. In more serious cases, anaphylactic shock, an acute and life-threatening reaction involving severe swelling of the airways, difficulty breathing, and decreased blood pressure may develop. 3. Diagnosis and prevention. People with a known onion allergy should avoid raw onions and other foods containing onions to prevent possible allergic reactions. Diagnosis of allergies includes skin tests or blood tests to determine the presence of antibodies to onions. 4. Treatment and urgent care. If an allergic reaction occurs, it is important to seek immediate medical attention. Treatment may include the use of antihistamines to relieve symptoms and epinephrine, adrenaline, to treat anaphylactic shock. 5. Individualize. Reactions to onions can vary from person to person. Some may have a mild reaction, while others may have a severe and dangerous reaction. Therefore, it is important to closely monitor your condition after consuming foods containing onions, especially if signs of allergy have been noted previously. Number 13. Pediatric food safety. Pediatric food safety is an important aspect of young children's health, taking into account their digestive and developmental needs. Raw onions pose potential risks to children for several reasons. 1. Difficulty digesting. Preschool-aged children's digestive systems are not fully developed and are less adapted to digesting certain foods, including raw onions. It can be difficult to digest due to its high content of complex carbohydrates and fiber. 2. Risk of discomfort. The spiciness of onions and their ability to irritate the mucous membranes of the stomach and intestines can cause discomfort in young children. This can manifest itself in the form of abdominal pain, heartburn, or gas. 3. Potential allergic reactions. Consumption of raw onions can cause allergic reactions in some children, manifesting as skin rashes, itching, facial swelling, or even anaphylactic shock. This is especially important to consider when introducing new foods into a child's diet. 4. Effect on digestion. Onions can stimulate the production of gastric juice and even contribute to changes in the intestinal microflora in children. This may not be desirable in the context of building healthy digestion in toddlers. 5. Dietary recommendations. Doctors and pediatricians often recommend avoiding the inclusion of raw onions in the diet of children until a certain age or until the formation of the digestive system is complete. This is to prevent possible negative effects on the baby's health. In general, when introducing new products into the child's diet, it is important to monitor his reaction and consult with a pediatrician about what products are safe to include in children's food depending on age and physiological features. Conclusion. After reviewing the 13 health conditions where you should refrain from eating raw onions, we see that they can aggravate symptoms and cause discomfort in people with a variety of health conditions. By avoiding raw onions in such cases, you can reduce the risk of unwanted health effects. Remember that your doctor's individualized recommendations play a key role in maintaining your health and well-being. What are your thoughts on this issue? Do you agree with these statements? If you have any questions, ask them in the comments. More information on this topic can be found in the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.